Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here, and it's starting with us. Welcome to the revolution. Welcome, Dr. Christie. I would love to hear more about your origin story, how you got to where you are today, what drew you to plastic surgery and the space that you're in now. And yeah, tell me everything.
Gosh, that's such a long, it's gonna be a long podcast. I actually have a very non-traditional background in medicine. I didn't have any family members or anyone that was in the field of medicine. I traveled all over the world. We had a very different upbringing. And when I was first introduced to science, sort of actually when I was a little bit older, sort of preteen, I was like the matrix clicked in terms of my brain. I just love everything about science. I really had an affinity for organic chemistry and just was like, I've always been fascinated from the second I've sort of known about scientific process methodology. And then I really, because I didn't have a lot of influence in terms of the medical field, I wasn't even in my bandwidth to think about becoming a doctor. It's not something I even thought about. I had interviewed with a optometrist at the time and thought, oh man, this is I can sell glasses and do eye exams. Like this is a good science prerequisite. And so that's kind of what got me in terms of college. I was doing the scientific prerequisites for ophthalmology school, and actually had not really shadowed, outside of just a, sort of clinical setting. And then I transferred to college, and my organic chemistry professor, I was teaching organic chemistry really just to make some extra money. And he pulled me aside one day and was like, I think you're like too smart to go into optometry school. Have you ever thought about medical school? And I mean, this is of course no offense to the optometrists out there. And I was like, no, I've never thought it. What do you have to do? And he was like, oh, you got to take this thing called the MCAT. It's actually like coming up in a couple of months. You should probably take a year off and study. And I was like, well, there's no time to lose. I should just take it and see if I get in. As I took it, and I really didn't have a lot of money to apply to a lot of med schools. I got into med school. It was amazing. And then that was really the beginning of the change in my life. I've since that day and just every day from medical school forward is a fascination from, I think when you don't have that exposure and it's like the first time you're seeing these things, it's just like, it's amazing. It's exciting. I just couldn't believe that I was also like a part of this. And then of course, my first rotation was surgery, and it was actually a C-section. And I was like, my God, this is the most incredible thing ever. And then I went from there to like a cardiothoracic surgery, and we were doing open heart massage. And it was just amazing. It's like you're holding someone's heart in your hand. And,
right.
And then I, went then to the vaginal delivery and was like, I don't know how amazing this part is. I think med school in your third year is so much fun in terms of, sort of trialing out all these things that I really had zero exposure to. So for me, it was just so incredible all the time. And then I really thought, okay, well, I love surgery so much. I wanted in my mind to do dermatology, I think like a lot of people do. And then I was just pretty grossed out by rashes. So I was like, probably better that I stick to the thing. So surgery was the second I thought general surgery was a great place to start because, it's so comprehensive. I love how they're the backbone of all hospital systems in terms of life-saving operations. So I did my general surgery residency at UC San Diego. This was an amazing 5 years of my life that really set foundational work. I have great mentorship there. And really, honestly, about, a few years, 3 or 4 years into that, I started thinking about specialties, because, the lifestyle general surgery is really fun, but after a while it wears on you for sure. And at the time there was a mentor that I had, and she did both a combination of reconstruction and the mastectomy. So she did breast cancer reconstruction and also the cancer operation. And so I stayed for I started shadowing her and staying for the reconstruction part. And there was, of course, immediately fascinated with plastic surgery because what I love about plastic surgery is it's artistic, sort of the artistic expression of what your technical execution is. And, after many years of general surgery, it becomes quite routine. There's only one way to take out a gallbladder. There are many ways we try, but they're generally one way and appy. And so you got these bread and butter things, but plastic surgery is so complicated. Every person, you don't even know, you can't even really plan. You don't know what to expect, especially in breast cancer reconstruction. You kind of just walk in and it's a disaster. And you're like, I got to make a breast out of this tissue that's here. And
Yeah.
it requires this kind of creativity that is incredibly fun. It keeps you, to me, it was very stimulating. And to this day, and I love it. And then I came out of training, and then I did my plastic surgery fellowship. So I got into plastic surgery, did plastic surgery fellowship, and went into a multi-specialty group with two guys that were amazing. And we just mostly did breast cancer reconstruction. We also did cosmetic stuff. And because I think, I was one of the, I was the only female in the group, a lot of cosmetic patients came to me. And I think a lot of patients that also, after they had recovered from cancer, were also the continuum of what that process did in terms of aging really kind of lines with me. And I started getting into some of the non-surgical stuff, trying to solve a lot of these, aging problems for them. And it was an impactful moment in terms of recognizing that first I saw these patients going through a lot of the, biochemical changes from the hormone blockage and from
Yeah.
chemotherapy, and how this kind of created an accelerated rate of aging that no matter, it didn't matter, who it was or what their age or if they were younger. It was something that I really realized, like, I'm doing the same treatment on this person, and on this person, but the breast cancer survivor is just not having the same result. And it was frustrating, but it made me also really think, there's something way beyond what's driving aging than what we're doing as plastic surgeons. We're not really, it's not really you're doing anti-aging reversal procedures, but at the end of the day, you're not really addressing the aging process. And then, I moved up to, my practice broke down. I got recruited to a big facial plastic surgeon up in Los Angeles. And that's where I started my plastic surgery up here. This was a very different scene. The Los Angeles plastic surgery scene, especially in Beverly Hills, is very different. It's a very, high profile, kind of cutthroat. And there was parts of many parts of the business that I really didn't align with. I can't stand the transactional nature. I don't like some of the deception. I don't like the lack of process or methodology. This was also a pivotal point in my career in terms of recognizing, like, what I don't like, what the problems I see interacting with, predominantly this is a female dominant specialty, and seeing the misinterpretation of a lot of what patients wanted, and the execution of that, or the dissatisfaction, and trying to understand, like, why is one person happy, why is another person unhappy with something. I think this is all a learning curve, but also being in this kind of very high stake environment also really
Yeah.
kind of pushed me to say, I've got to figure out some of these are really big questions. And also at the same time, we're in the era of, like, Instagram, and everybody's like coming in now with filtered pictures of what they want to
Sure.
look
Yeah.
like. And this was
Totally.
all very, like, I mean, who are we becoming? What are we doing? And then COVID happened. And I think that was a moment also where I took pause in my own practice to say, I don't know that I really want to continue doing just cosmetic stuff. I think I really just the reconstruction part. So I kind of went back to my roots in terms of breast cancer reconstruction. And from there, this is when I started my own practice, which has been about 7 years now. And really, the whole concept of that was, I said, I didn't want to practice plastic surgery in the way that we practice it right now. I really want to understand the specialty and how patients navigate through it with some type of process and understanding of, like, well, what's this what are we doing here? What are we trying to accomplish? And that's where I really came up with this algorithm that is really a methodology that we call the beauty matrix. And at the end of the day, that is kind of how we sort of enter this beauty matrix, and people come in at different points in their life. Some people more interested early, some people don't catch on till later. But the
Yeah.
truth is, you're just thrown into this disaster right now. And right now, most patients come to surgeons from, my friend, or they heard you on, the sort of social media, or you've had some PR on you. And this is not really, I think it introduces you to the person, but there's not really a process or method. And also there's a big distinction in terms of the players that are playing in the aesthetic field. We have we have dermatologists, we have facial plastics, we have general plastics, we have people who are not trained at all. And I think
Yeah.
this is where there's a lot of mishmash in terms of patients' experience, outcomes, understanding of anatomy and physiology, technologies in the field, I think, or lack thereof. And patients pay the price for that. Consumers pay the price. There's lots of, and we're not talking about small prices. This is a big
Oh, yeah.
investment in aesthetics is an expensive specialty. And I think this is also where there's not a good return on investment. So I really started off with saying, we need to have some kind of methodology in this process. And I developed this algorithm that really helps patients understand not just where they're at in terms of their aging. So we really like to look at objective metrics of, what does your skin look? What is your skin health like? How is it behaving? And bringing that further then to looking at, how can we change some of the behavior of the skins? And then how does lifestyle, how do all these other things intertwine? And it just evolved into now, I got very interested in being like, I mean, I'm doing these aesthetic treatments, but we're missing something here. And I think that that history from the breast cancer patients really made me we've got to figure out some internal processes. At the same time, I also had my own child when I was 40. And that was a huge metabolic toll on my body that I think as surgeons, we're just notorious for this, like, go, go, go. We overcome
Right.
everything. We just power through it. And this was just, it felt like, wow, I don't think I can power through this. I think this is like,
Right.
I feel overwhelmed at the moment. And that's where I
Yeah,
really
it's
became
amazing how
interested.
that can take down the strongest of people. Yeah, I experienced that myself.
Children. Yeah.
Yeah, no, they're relentless. So tell me more about the beauty matrix. Like, how does it look like if you enter it at like 30 versus 40 versus 50 or 60? And like, we were talking about earlier about how aging well is really proactive, not reactive, but very few people really get to it in the proactive stage. So what does that look like?
Yeah, great question. The beauty matrix, it's really about my process is all about personalization. So I think also the other element to this is we really need to meet and understand the patient and their lifestyle and what they can actually accomplish, and also prioritize treatments that make sense for their biologic makeup, and environmental lifestyle. So really, it's very different depending on obviously what age you present. If you're coming in your 30s, the truth is you have not really experienced significant aging at all. We do have some collagen breakdown. I think this, in terms of a preventative strategy, my approach is always a skin health approach first. The skin is an organ that requires maintenance. It also bears the brunt of our interaction with our environment, and
Right.
is very much a reflection of that as well. And the rate of aging, or the rate of also the durability of some of these aesthetic treatments that people always ask this question, like, how long is this result going to last? This all depends on your rate of aging, and also your environmental exposure. If you are
Right.
exposing yourself more and more to these things, we're going to have a higher rate. So I think now that some of what has become the field of longevity, that to me was really not the metric I was chasing, but rather just understanding that there's an internal component to this. If you're coming in your 30s, you're thinking, okay, well, you're not really aging that much, but how can you understand your own risk profiling to reduce some of these things that you're predisposed to? But also, I mean, that's sort of the layer that intertwines what's internal. But externally, it's really just about understanding the skin as an organ. I think when you take a skin health approach first, this is very, sort of when you look at other regions in the world, they prioritize that over, say, just, filling your face or lifting your
Right.
face, or, I think there's also very big differences across the world in terms of ethnicities and different skin types, and on what treatments you can do and how you approach the aging process. And understanding that fundamental difference, I think, was the beginning of actually, even in a very more generic way, with it's just saying, hey, we have different ethnicities, we have different skin types and different makeups, we have different dermal thicknesses, we have different, susceptibility to the sun, and how does that all play into just the skin as an organ and its rate of aging. And so I really, for the first part, is really trying to understand what the patients, when they first come in, whether you're 30 or you're 60, you're going to come in more for correctional work at this point. We have more aging to reverse and correct. This takes a much more concerted effort, usually a stronger financial investment, and also usually requires an integration of some internal health aspect. We really have to understand and correct metabolic processes that are also driving that internal aging. When we're talking about somebody who's coming in their 30s, this is more about actually educating them, helping them understand some of the framework of their own biology, like their skin types, what sun exposure does, what kind of UV damage you've accumulated to date, where you're at in terms of your lifestyle and how that might be affecting you. And then implementing tools and techniques that are about, maintenance. Some may be correctional, like maybe you have acne, maybe you have some pigment we want to reverse at that point, maybe we want to boost a little bit of collagen. So we'll do some correctional stuff, but more it's about educating you, helping you understand your own biology, and helping you understand how maintenance and certain therapies and skin treatments and skin products return on your investment, and curating all that in a very personalized way to that individual.
Yeah, no, I think then that's such a unique way to approach it. I mean, you were saying earlier, it's a female dominant. It's not female dominant in terms of the providers. I mean, in
No.
fact, that's
Yes.
the exception. It's a female dominant demographic. But I think you
Yeah.
coming at it from a woman as a female plastic surgeon is unique, and that gives you, I think, that gift of being able to look at the whole person that is not we don't often see as much with our male colleagues, no offense, but
Yeah.
and I think
Yeah. And listen, I have
that's so
also
important.
I have many sisters, I have a lot of sisters, and I think it's like we're all in the same group, and we think about
Yeah.
how these are the discussions we have with ourselves internally,
Right. Yes.
So
Yes. Yeah. Tell me, so, you have such a great, unique global perspective. Tell me how that's shaped your philosophy on beauty, and all, the cross-cultural context that you kind of look at.
yeah, listen, I mean, California is a melting pot of ethnicities in terms of, we have lots of mixed ethnicities. And even when people come in, I always ask them, if they've ever done any kind of genetic testing like 23andMe or something. This gives you insight in terms of, how they are going to react to the technologies, what's their, what you can expect in terms of, okay, what technology is even going to give a result in the first place. And also helps me paint the picture for them in terms of, okay, this kind of correctional work is going to require this many treatments if we go this non-surgical route versus the surgical route. So, I think having this bigger toolbox of toys as a plastic surgeon, but also as, doing regenerative medicine, doing longevity medicine. It's really about, well, what's best for you at this moment? What's going to be the best return on your investment, and sort of dissecting that all out with them. My global approach is very much, I mean, I grew up in Asia and Europe, and I think, when we look at Asian plastic surgery, they dominantly focus on skin. They're very preventative in their management and their lifestyles, and their culture actually reinforces this all. Whereas, like, when we come out to America, you're taking the same kind of ethnic groups like Asians, we there's a different kind. We act differently. We have different viewpoints about the sun and about tanning and
Right.
all these other things. And so I think
Yeah.
like those are things are super important to understand. And when curating, recommendations for an individual, you can't just, the technology is not going to react the same on every single skin type. You're not going to have the same outcome. You're not going to have the same result. You have to understand, what are we talking about? Like, for example, in Asians, we have 3 to 4 times more collagen and elastin than, say, a Caucasian, and what's interesting in my own personal background of this is that my sisters are half sisters. And so we have the same father, but different mothers. So my mom is Asian. Their mom is American, white. And so while we're very close in age, we're aging very differently. The problem
Yeah.
is, like, my sister, volume is she loves volume. Like, a little bit of volume goes a long way on her. The last thing I want in my face is more volume. And so it's like
Right.
we already are starting with very different building blocks. So I think this is about, that global perspective, understanding of the differences in culture, ethnicities, and how those all interplay with actually aesthetic outcomes is that's just the foundation in my mind, foundational work of understanding, well, what are the technologies that are going to be a good ROI? What are the technologies I should avoid? Like, for example, in Asians, we already have a lot more collagen. You can do some more of these, have high frequency focus ultrasound as a maintenance, say, treatment for your collagen boosting, but really you don't want to play too much with some of the laser therapies, especially in trained hands, because this can cause more damage than it's going to give
Right.
you reward. And so it's always that, also as a plastic surgeon, I think very much about, I don't care about the short-term moment, that what I'm going to do for correction is not about this. It's about the continuum. And so I'm not going
Yeah.
to I'm not going to do something that's going to screw myself 2 years later when I'm trying to operate on you,
Exactly.
So it's also understanding, like, okay, well, what's the boundaries of each of these treatments? How much filler might I use? How much, technology might I do before I say, now it's time for us to actually, like, suspend the muscle because our skin has aging well. We prevented that aging process, but now we have some muscle aging, and this requires
Yeah.
something surgical.
Yeah. Let's dive into the longevity space, or the anti-aging peptide world, and all the stuff that comes with that you and I have talked about. It's such a wild west kind of space right now, and there's so much out there that is confusing to people, and exciting, and there's a lot of good information, but I think it's outweighed by a lot of misinformation. So let's break it down. Help me educate our audience in the lay of the land here.
Gosh, okay, that's a big asking. Say my philosophy in terms of even how I've evolved in this industry. First off, I think number one, my personal metric is, as even in the patients I treat, is not to chase longevity. I also think, specifically from more of the female demographic that I manage. And we actually have many men as well too, so I shouldn't say that. But we have obviously a predominantly female demographic. They're also have a very clear distinction in terms of what their metric is. Women actually, in fact, I fully have done, these kinds of reveals of looking at, patients, they deep dive into their own data. And, like, when I tell them, oh, congratulations, like you carry longevity genes. It's like there's an audible groan, like, like, women are not trying to live forever. It's not, I mean, that's not
No,
saying
we're tired. We're like, just,
but we want
give me a nap.
to, the big thing to me is you want to live well. You want to live well, and you want to
Right.
have a good quality of life. We all at the end of the day, we want to be happy. We want to be, healthy. We want to be able to be there for our families, being the kind of caregivers and the type of people that we are within society. We want to be able to be successful, and we want to look cute while this all happens. We want to age.
Totally.
All of it. We don't look weird. And so I think to me, when we think about, and that's really the gist of my entire approach is, I'm not here to chase longevity, but I am here to chase quality of life. When we think about, my big argument and what I've demonstrated in my own data is that when we use quality of life metrics as a form of medicine, well, guess what? You actually not only enhance longevity because you mitigate risks factors early, you change the trajectory of someone's life, but you also have the benefit of changing the trajectory of their aesthetic aging. You create youthfulness, you create resilience in the skin, you create metabolic flexibility, you create neuroplasticity. These are all things that to me are about youth. It's not about just your capacity to do that in a moment, but it's about sustainability of that result too. So first off in this space, it is everybody wants to be the best version of themselves. That's what the longevity field is all about. But where there's lots of snake oil is just like, what does that mean? And I think that's where expertise is so important, because the truth is that there's actually more of a plethora of therapeutics and interventions and diagnostics, that there's very few people that are doing the hard work to put that together in terms of a personalized context. Really, I can't stress enough, to me, the future of medicine is precision or personalized medicine. It is not longevity medicine. I mean, longevity is an aspect of it, but they intertwine. And molecular medicine, so really understanding individual biochemistry. And the more I do precision medicine, the more I realize it. First off, it's precision medicine for a reason, because it's incredibly precise. You marvel at your own ability to make these kinds of changes in people's lives because you're just following their personalized data, not making decisions based off sort of epidemiologic data.
Right.
So I mean, my caution, and what's exciting about the field, and even for me, it's very exciting, is just all the new therapeutics, all of the money being poured in, all of the artificial intelligence, all of these things that we need actually to progress the field. But at the same time, there's way more hype than there is reality. The truth is that biochemistry, the human body is complicated, and each individual has different complexities that you have to understand. You have to understand how you interact with your environment. And that's the whole concept of some of this preventative strategy, is that we actually understand now that we have the capacity to change the trajectory of our lives with an understanding of our own physiology and biology. That's what the diagnostics do. But you have to understand that. You have to have somebody who also understands that, who's guiding you through that. And a lot of these sexier therapeutics, I've now managed many people who've also come from these, bigger longevity clinics and spent hundreds and thousands of dollars on different of these therapies. And the sustainability is not there. They might spend, tons of money on a treatment to say detoxify, but if you don't change the environment and the exposure, then it doesn't matter. That's not sustainable. You're gonna have a few weeks of that, and then you ask yourself, was that a good return on my investment? Did I just spend $10,000 for 2 weeks of results or 4 weeks of a result? So also that's also a process to understand that I take my patients through. There's also a hierarchy of how we progress. It makes no sense to do sexy therapies, peptides, all these things without foundational work. If you're trying to stimulate a biochemical pathway over and over, and that's what you're doing with these peptides, first off, we have to talk about harmony in terms of, disrupting harmony in terms of balance, by constantly activating these pathways over and over. But if you don't have the precursor products to say, create that response, for example, if you have low neurotransmitters like norepinephrine, epinephrine, and you are really, really deficient in vitamin C, this is a precursor essential vitamin for the creation of these products. So actually, a lot of really the foundational work comes from understanding very basic things. What's your nutrition? What's your life?
Absolutely. Yeah. And I see that in family medicine, just basic, cardiac prevention, cancer, nutrition, all of that. I have patients that come in doing hundreds of thousands of dollars of peptide and stem cell therapy, but, haven't had their cholesterol checked. And so, and have coronary artery obstruction. So I think that gets, like you said, that foundational piece gets so lost when there's the shiny object, that seems to.
I just remember this is like This is a capitalist society, this is click and bait, and what's exciting, especially like, as I practice across the world, we in America we have so much freedom of what we can do and the therapies that we can engage in, and also the level of personalization that we have access to. I think the challenge is understanding how to put all that together so that you return on your investments, for each one of those things. You have to understand the continuum of aging. It's also, you spend your entire life creating those problems, creating those environments, creating that lifestyle, creating that mindset. Those all interplay to how you're driving aging. And it takes some time to reverse those processes, biochemical processes. And also, at the end of the day, to me, I'm just trying to create homeostasis and trying to create balance, biochemical balance, physiologic balance, environmental balance. And that's what aging well and aging gracefully to me is about. It's so much more than what we superficially think of in aesthetic medicine.
Yeah. Let's, a lot of people come to me constantly with questions about peptides and stem cells and sourcing and, what works, what doesn't. And I know you have a lot of opinions on this. Give me your thoughts.
God. Okay. Let's start with peptides. Not all peptides are created equal. Peptides made a big splash actually many years ago. But yes, most of Hollywood has been using peptides for some time. Peptides, once again, don't overcome everything. They don't overcome your aging. There are some that, via their mechanism of action, they have dramatic effects or results, like these GLPs can, like, some of these other compounds like melanotan, you can see right away. Then there are other ones that have more silent effects. But when you think about, these peptides in terms of their capacity to overcome or be synergistic really with some of the lifestyle changes that you're doing and dietary changes to enhance a certain pathway. Like, for example, in our patients, it's like one of my big things is to help identify, well, what's really driving your aging? When we start looking at all their data and say it's oxidative stress inflammaging, which is a term that people use, quite casually. But really, when you start putting all of this data together and you say, oh, this basically the predisposition for elevated lipids creates this lipid peroxidation breakdown that sort of contributes to this oxidative burden that also, by the way, this person is susceptible to oxidative stress via all these other pathways too. And so you start to see now some biochemical evidence of, these markers of, now we have oxidative stress that's playing a big role. Well, how do we overcome, an immune dysregulation, oxidative stress? Yes, we want to look at in a strategic way what their foundational work is, in terms of diet, lifestyle, toxin burdens, etc. But we also want to think about, how we are really approaching let's just say also depending on what time, like what age you come in, how we can overcome, say, to give this return on investment for the patient, where it's, you can create consistency in some one metric, but you can't always create that consistency for this kind of duration. So that's where peptides, I think, really play a big role. They can really overcome, really help to, on the back end, say, support a process. Oxidative stress is happening. You need to improve your diet because you need to reduce your cholesterol. You need to maybe take something that reduces your cholesterol to help excretion of that. You also want to think about, keep taking high dose antioxidants here to, offset some of the oxidative stress that your body is carrying. But on the back end, when we're saying, well, how do we want to modulate this immune system as well to downregulate some of this predisposition for pro-inflammatory cytokines, et cetera. There's a combination of different supplements that we can use that are to your biology. So when we start to see some of these genetic mutations, we can say, well, we see the expression of this mutation, and we know that these compounds act on these pathways. So this is a great intervention here. So that's one, just with nutraceuticals. Now layer peptides into that. We can say, well, there's some great peptides that do immune modulation, TB500, BPC157, KPV. These are great ways, to then say, okay, well, now we're really working on somebody's oxidative stress burden as a mechanism of what's their primary driver of aging. And we're hitting it from all these different angles in a very strategic way. And that is a very synergistic way to approach, say that specific drive. Now take, stem cells as a whole other topic of conversation. And, the regenerative field is extremely exciting. I'm really into regenerative aesthetics. I think this is what creates a very good return on investment and a much better sustainability of results. They actually are getting to the core of what's, it's on the cellular aging. The truth is like this is an evolving technology, and there's lots of nuances in terms of extraction of these components, cryopreservation of them, expansion of them, delivery of them to you in stable amounts that also represent with good clinical data that represents changes, these cellular changes we're looking for. So there's a paucity of that on the market at the moment. Also, the other thing to consider here in terms of stem cells is the sourcing. And we can also go back to peptide sourcing as well. But sourcing for stem cells is across the board. You either have your own or it's coming from somebody else. So it's really the coming from somebody else that we want to think about. Because the truth is we don't have a lot of information about, disease transfer. We don't have a lot of information about the immune or immunogenicity or the plausible immunogenicity of somebody else's cells, whether that's animal, because these are different species, right? Salmon, sperm, all these things. These are different species than humans. And while we share some genetic similarities, there's a lot of distinct differences that actually relate to the immune response. And that immune response is what's creating that regenerative potential. And so we want to think about those interactions. I personally am not very much a fan of allogenic sourcing outside of topical skin stuff because I'm also very conservative and safe. Once again, I'm not interested in that short-term gain for a long-term strain, So it's really saying, hey, why would you move to stem cell therapy so quickly? I mean, this is outside of the people who are in more dire situations, severe injuries, cancers. I think at these points, these are, you do a risk to benefit analysis in those moments and ask what your research that you have. But in general, I think we need to be very cautious about the sourcing. I personally interview all CEOs of companies that we partner with, because I think it's a super important part to understand that person's integrity and the way that they run the business and some of the decision makings that they do, so that you at the end of the day, you're really relying on them to be truthful and transparent about
and ethical,
and about quality control. So that goes back.
That's such a huge piece of it. I think that's lost on the general public, that the real danger that exists with these, that stem cells that are sourced from not your own body. I think people sometimes don't understand that, and that there are risks. Real risks to that.
Real risks. And we know this from, the literature. We know about prion disease, disease transfer. I think understanding the genetic makeup of the donors is super important part. And also the truth is, what we do see is there is some immunogenicity. You might find that the first time you do the treatment, it's exciting and you get a really good result. That's expected on the first treatment because your body is just introduced to this new compound. As you get subsequent treatments, that goes down in terms of the even subjective response to that. And so what does that tell you? That tells you that now you're going to have a downgrade in terms of your expected efficacy, because you have something that we're missing here in terms of actual biochemical makeup and compatibility. We'll see.
And what about
the science check out?
Yeah. And what about peptide sourcing, which is a kind of another animal?
Yeah, I mean, this is the wild west as well. Everybody has a Chinese peptide dealer. I personally, I did not introduce peptides into my practice until I aligned with my own manufacturing source. I think it is really challenging. It's really challenging in certain states rather than others. Peptides are quite easy to synthesize, but also you're injecting them into your body. And so the risk profiling is very high. People are also doing IVs, all kinds of stuff. You've got to align with you've got to trace, as a physician, clinician, you've got to trace the sourcing all the way back and ask yourself how comfortable you feel with that process and the risk to benefit. I think also people, once again, have a very overly hyped view of peptides. The reality of it is there's a lot of cumbersomeness to the injection process in terms of non-medically trained people drawing from a vial, giving yourself the right dose, injecting yourself. And the way that a lot of these peptides are manufactured, which we're talking about, single peptide sourcing. So you've got like BPC 157, KBB, TB500, and it's like you're now doing 3 different injections. And, so I also there's an archaicness in terms of how people are approaching it, a little bit from the biohacking world, where you're just like, let me inject myself with as many things as possible. I mean, this makes no sense. It just doesn't make any biochemical or physiologic sense. And from a lifestyle perspective, unless this is your full-time job, this also makes sense. It's not executable and sustainable for anybody in the real world. So that's also partly, what you have to understand. So a much better return on investment is aligning with the right practitioner, who obviously you can trust the sourcing, but also has some intelligence in terms of the way that they're delivering that peptide. For example, I personally curate a cocktail of these different peptides if I'm trying to immune modulate. Well, I want a number of these different ones, and also I only want one injection. I also want to improve the bioavailability of that that peptide in the way that it's delivered so that we can do shorter courses. So I've also had patients that have come into my practice who apparently have been on peptides for years, growth hormone peptides, which of course I don't advocate for. That's not how peptides are not supposed to be used that way. When we think about a peptide, it's a signaling molecule. It acts for a matter of seconds and then goes away. When you constantly activate that pathway over and over, you create a receptor sort of resistance similar to insulin resistance. And also you downregulate the amount of receptors that are produced. That's why you have to keep marching up on the dosing to overcome this. And peptides are really meant to sort of bump that physiologic pathway a little bit more, but not to overwhelm it,
Right.
And I think that's about understanding harmony in terms of what you're trying to accomplish. Like this goes back to my whole mantra of like, you've got to have a strategy. You've got to know what you're doing. You can't just randomly do things. You don't get anywhere. You just spin your wheels. And at the end of the day, you're the one wasting money and time,
Right.
So I think when you really understand, my aging is being driven by my oxidative stress burden. I'm really going to focus on antioxidant capacity. I'm really going to focus on my immune system support and modulation, and how also potentially your emotional health intertwines into that. I mean, these are the things that we kind of individually point out to you. And then on the back end, you're now doing a single injection. Like I said, in combination with all these other things, it's amazing what you can overcome. So I think they're great tools, but there's also a ton of hype. And I know so many people that have been on them or think they've been on them. When I measure their values, I'm like, you're definitely not on growth hormone because you are in the bottom percentile for growth hormone. And but they've been paying for that for 2 years, and also no one is checking. So there's also a lot of lack of transparency in terms of, peptide. It doesn't really have to have the peptide. You wouldn't even know. And so that's also part of good formulations of peptides formulations. You can tell, when you're taking them and when you're not taking them, you know the difference. And that's also part of, I think, the benefit of being educated about what you're doing.
Yeah, no, absolutely. And having that like true clinical oversight with someone knows what they're doing is a huge differentiator. Let's talk a little bit about the emotional and mental health component that you and I are both very aligned on.
Mm-hmm.
Tell me about what you're doing with ExoMind and TMS and how it's going.
First off, it's an amazing technology. I mentioned to you, I brought this into my practice, and that's sort of how we met. Was I really, from my data and even my own personal biology, I recognized that emotional health was a big driver of aging, meaning stress management. And I'm going to say this is true for pretty much every surgeon, for sure. A physician surgeon out there, where emotional health is and you're surprised by it yourself, because what I saw in my own data was, wow, it's really a subconscious state of mind. There's not even a lot of the men I have in my practice too, there's not a very high perception of stress. This is part of actually the masculinity, where you're just, I think, and also as a surgeon, where you just are like, I can take it, I can do it, you can do it all, you can get through it, you can power through it. But guess who takes the hit? Your body takes the hit. Your health takes the hit. Your biochemical, your longevity takes the hit. And this is exactly why when we see in this data of surgeons or physicians have shorter lifespans than the average population. I mean, this is not surprising in any way to me, just based on the lifestyle and also the mindset. And so, but then I asked myself this question of well, how can you overcome a subconscious state of mind? I mean, you have stress, but it's like you're not in the position to quit the job, to leave the family, to just do nothing with your life, or to be, to hide away. I think that's what you do in extreme cases when you're completely burnt out. But, if there's an awareness of what's coming on, but you just don't know how to interact on it. I think that's where I really sought out technologies and how can we overcome this? Yes, we can do all these things, but at the end of the day, I can't change someone's lifestyle if they don't have the mindset, Or for example, if you have, uncontrolled ADD, you're not going to follow through on some of the things that we want you to do, or some of the lifestyle things. And there has to be an active participation. You have to both play a role, So I think that's where I looked at TMS therapy. At that time, I was really looking for different therapeutics to really intervene on a subconscious state of mind, to be honest with you. I thought, you can do, it's one thing to say, you're going to psychotherapy, you're doing the mindfulness and meditation, but the reality of what I saw in my practice, but also in myself, was just that wasn't working. It's not good enough. It's not a good return on investment for time. It's these are outdated techniques for the modern era we live in. It's a fast-paced world of technology, and we need these kinds of, what can I do that really returns for this moment, these 30 minutes of my life. And TNS fascinated me in terms of the actual literature on it and what it could do. And so I was very interested when I heard about it as a, a sort of a wellness device, in terms of using it for non-disease states. And obviously, we were one of the pioneers. I mean, you really are the pioneer in this in terms of looking at this data in non-diseased patients. And that was where I was very intrigued in terms of, well, what can these kinds of therapies do and how can they intervene? And what we've seen from our own data in terms of its contribution, it's just hugely contributed to people's well-being, overall sense of well-being, emotional regulation. And it's subtle, but it's sort of, to me, I think of it as like we work at our body, we have to work at our brain. As we've evolved in this world, we have not really biologically adapted to the technological world we live in. So it requires us to very much take the time to think of those processes and intervene on some of the changes that we've had from a lifestyle and spend more time. We just don't have, especially like in more urban areas, the kind of, access to solitude, to nature, to the things that restore your energy. So it's an understanding of, well, what restores your energy. And I think, TMS for many is an excellent therapy in the busy world that we live in, where you can take that 30 minutes and you can get some electrical stimulation that is also super synergistic with, say, peptide therapy or personalized medicine.
Totally.
Supplement support. It's amazing. Yeah.
Yeah, I really describe it as a resilience tool more than anything else, because I think that's really where the power of it is. And that just, I always say life is 10% what happens to you and 90% how you react to it. And there's no controlling the amount of craziness that we have. But, what I've seen certainly in myself, and I think you have too, with a lot of our patients, is that this gives you that resilience that we all so, so desperately need right now.
Right. Right. I mean, and also just on the back end, like say we have a patient who's, in her 70s and she came in with some significant cognitive decline. And I think it's very hard to use our existing system and processes to intervene on that. It's cumbersome, just arranging all of it. But coming in and every week as a standing appointment so you don't forget it and doing a little exercise to your brain. Well, I mean, it's been shocking, the reversal of, obviously we've done other things as well, but the reversal of her cognitive health with these types of therapies. And because it's so easy to use, it's so user friendly, and it's so relatable, sustainable, easy to accomplish. I think it's a great tool that we should all be using. I really see this as a very big future in the field of medicine.
Yeah, no, me too. And it's so exciting. So what's on the horizon for you? What can we look forward to from the amazing Dr. Christie? I know that feeling.
We are growing a lot. It's exciting. It's really fun. I feel like it's the culmination of all the hard work in terms of some of the methodologies that I've put together, of the demand that we have. And we've been working on many things. I'm also really trying to scale personalized medicine. So working in a consulting role, helping to further some of the companies in terms of regenerative therapeutics and bring new pharmaceuticals and peptide therapies and some of these things that we have clinically proven into the market, and so that other people can also experience, navigating this aging process. I hope the goal in the longer term goal would be to democratize what we do. It would be wonderful to make this very accessible to everybody. And so I think, it's an exciting time in the field. My biggest advice to people is don't be a victim of the hype. A lot of the things that you can do, you don't need a lot of money to do it. Actually, most of the things that you need to do are foundational. The investment should be in aligning with the right person to guide those interventions, even with whatever resources you have. It's not about just participating or having FOMO. You're actually just going to fully waste your time and money. If it's like, everybody's on peptides, I've got to try peptides. No.
Right.
It should be peptides are having a moment. Who's the peptide guru that I can align with, that I can trust the sourcing, that I can feel comfortable with, and that also I can have a discussion about how this relates to my own biology and health.
Yeah, I think that's such great advice. I love it. Give us all your social handles, resources. How can our listeners get in touch with you and find you and ask you more questions?
I'm on Instagram at dr.christie. My website is drchristiela.com. And yeah, you can always call my office and inquire about consults. We always like to start with understanding you. So we call our intro visit really the beauty matrix consultation. This is really to help understand where you're at in the matrix, what you want, what you're trying to accomplish, what you need, and then giving you some direction after.
I love it. And I've been to Dr. Christie's office. It is a fabulous spot in Beverly Hills and worth a visit. So thank you so much, Dr. Christie, for your time today. It was an honor and a pleasure. And I hope, I want us all to age gracefully and strategically and live within the beauty matrix and thrive and all the good stuff. Thank you so much.
Thank you, Georgina. It was great. Always great chatting with you.
Take care. Bye-bye.
Bye.
Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.